Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Anti-inflammatory and anti-neoplastic drugs. An appropriate nursing diagnosis for clients who are taking NSAIDs and anticoagulants would be which of the following? Option A. Risk for injury related to prolonged bleeding time, inhibition of platelet aggregation, and increased risk of GI bleeding. Option B. Potential for injury related to GI toxicity and decrease in bleeding time. Option C. Altered protection related to GI bleeding and increasing platelet aggregation. Option D. Risk for injury related to thrombocytosis, prolonged prothrombin time. Right answer is Option A. Risk for injury related to prolonged bleeding time, inhibition of platelet aggregation, and increased risk of GI bleeding. The nursing diagnosis addresses all the interactions that pose a threat to the client taking both these drugs. Choice B is incorrect because bleeding time is prolonged, not decreased, when both drugs are used. Choice C is incorrect because platelet aggregation is inhibited, not increased, when both drugs are used. Choice D is incorrect because thrombocytosis does not occur with use of either drugs. Teaching has been adequate when a client being treated with acetylsalicylic acid states. Option A. I can crush the pills before I swallow them. Option B. I should take the pills with antacids. Option C. Taking the pills on an empty stomach will help absorption. Option D. If the pills smell like vinegar, I should throw them out. Right answer is Option D. If the pills smell like vinegar, I should throw them out. Any aspirin should be discarded if a vinegar odor is noticed. Crushing is not recommended for sustained release preparations. Antacids impair absorption. Taking the medication on an empty stomach will increase GI irritation. Which of the following groups of clients are most at risk for GI bleeding from the use of NSAIDs? Option A. Clients with dysmenorrhea. Option B. Clients with headaches. Option C. Clients with arthritis. Option D. Clients with renal failure. Right answer is Option C. Clients with arthritis. Clients with arthritis are taking the drugs for prolonged periods of time and may take higher doses. Choices A and B are incorrect because the use of NSAIDs with these clients is intermittent. Renal failure is a contraindication for NSAIDs because most of the drug is excreted through the kidneys. To minimize the risk of dyspnea and GI bleeding, OTC ibuprofen is given. Option A. IV. Option B. With orange juice. Option C. On an empty stomach. Option D. With meals. Right answer is Option D. With meals. Taking ibuprofen with meals will decrease GI irritation. Ibuprofen is never given IV. Orange juice may promote acidity and increase gastric irritation. Ibuprofen will cause GI upset if given on an empty stomach. Which of the following NSAIDs is used to prevent thrombosis? Option A. Motrin. Option B. Motrin. Option C. Aspirin. Option D. Naproxen. Right answer is Option C. Aspirin. Aspirin prevents platelet aggregation and thereby has an anticoagulant effect. Nurse Corrine may expect to administer azathioprine, Imuran, to a transplant client in which of the following conditions? Option A. Prevention of chronic rejection. Option B. Prevention of acute rejection. Option C. Management of chronic rejection. Option D. Treatment of acute rejection. Right answer is Option B. Prevention of acute rejection. Azathioprine inhibits humoral and cellular immunity during the early stages of lymphoid differentiation and is useful in preventing the onset of acute rejection. Which of the following laboratory tests should be monitored when a client is receiving azathioprine? Option A. CBC. Option B. BUN. Option C. Electrolytes. Option D. Sedimentation rate. Right answer is option A. CBC. CBC will identify leukopenia, a common side effect. In a transplant client, the action of cyclosporine is to option A. Defend the body against foreign antigens. Option B. Inhibit T cells in response to antigens. Option C. Inhibit B-cell immunoglobulin. Option D. Intensify the production of T lymphocytes. Right answer is option B. Inhibit T cells in response to antigens. The primary action of cyclosporine is to inhibit T cell generation in response to transplant antigens. Client teaching for mycophenolate mofetil must include instructions to option A. Take with food. Option B. Avoid use of corticosteroid. Option C. Monitor for adverse effects. Option D. Practice effective contraception. Right answer is option D. Practice effective contraception. Effective contraception is essential because of the potential for teratogenic effects. It is recommended that the drug be taken on empty stomach. The drug is often given with corticosteroid. All medication should be monitored for side effects. Which of the following client comments demonstrates that teaching has been successful regarding cyclosporine therapy? Option A. I need to mix the medicine in styrofoam. Option B. I should take the medication on an empty stomach. Option C. I need to be consistent about when I take it and also monitor how much fat is in my food. Option D. If I vomit, I should take another dose. Right answer is option C. I need to be consistent about when I take it and also monitor how much fat is in my food. Cyclosporines need to be taken consistently in relation to meals, and fat content should not vary to maintain serum levels. Thanks for watching. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.